honest, unfiltered Canadian, the conversation we should be having. Let's get started.
We have the highest food inflation in the G7. The highest. Higher than the US, actually double than the US. We have 2.5 million food bank visits in a single month. A quarter of them are children. And just last week, I received one of the toughest, worst emails I think I've ever received in my 3 years as the Member of Parliament for Oxford. I woke up, I looked at an email from a senior. She said, "How can I apply for MAID?" She wanted to end her life. And in that email, she talked about the reason why. She said she can't afford to eat. She doesn't feel like being a burden on her own family, on her kids. That is a story from my writing. This is happening in Canada.
As affordability pressures intensify across Canada, the country's expanding MAID, that's Medical Assistance in Dying framework, is being pulled into a wider ethical debate. Critics argue economic hardship should never intersect with end-of-life decisions, while supporters insist autonomy must remain paramount. Eddie, when I saw this Ontario MP standing up the other day and making that statement about the email,
right,
I was just gobsmacked. I was at a loss for words. The fact that a senior in this country is in a position to find themselves writing their MP and asking for information and assistance in setting up assistance in dying.
right.
What does that say about our country?
What does that say about our society here? When I read about it myself, I was sort of taken aback by the fact that, Gary, you know what? Let's not put the blinders on. I don't think this MP is making this stuff up. This actually exists in our country that you and I very often call it a wonderful country and a great place to live. And when you hear stories like this, it kind of reminds us that not everybody is as fortunate as a lot of us are. And in this particular case, you know what? I'm gobsmacked like you. But I don't think we should turn a blind eye to the fact that this actually does happen. In our country, in this day and age, it shouldn't happen. I guess that's what we're saying, right?
Well, exactly. But yes, MAID is really what you would say a compassionate choice for certain cases. However, now all of a sudden we're getting like these social economic vulnerabilities pulled into the conversation that could influence decisions. Can you imagine? I just cannot imagine somebody being in that kind of a position to be forced to do something like this.
Be forced to choose death because they can't afford life?
Yeah.
Like, that is...
And they don't want to be a burden. And what really struck home to me and really tore at me was when he said that this individual did not want to be a burden on their family.
Mm-hmm.
Can you imagine if the family knew that this person had written to an MP asking for this? Can you imagine how they must have felt or how they would feel? I just can't believe it. And I mean, we're crossing all sectors here because seniors and especially frail seniors or seniors who, have disabilities and they're living in poverty. They, maybe all by themselves basically and living in poverty and they have a disability and they're struggling with rising living costs and not knowing if they're going to be all of a sudden out on the street at the end of the month because they don't have the money.
They're faced with living outdoors and being homeless. Like Gary, it's I guess it's hard for me to fathom because I'm not there. One can only imagine what they're going through. Mental health issues or not, physical health issues or not. Having to look at struggling to live where they've got a choice that, you know what, I need help here. I'm not going to get it. And my choice now is to live out on the street. Like, how does a person in our country actually have to come to that kind of a decision? I think is more the question we should be asking ourselves and asking our MPs and our government. How widespread is this? How often does it happen? What's wrong with our social net programs that will help the elderly or those that are physically or mentally impaired, where they're forced into making a decision like this? And then again, all the individuals that actually review the circumstances and make a decision on whether or not they get a green light or not, it's just an added bit of pressure for them to make the right decision, because now above and beyond just terminal health conditions, it's kind of opening itself up to more decisions made based on not necessarily scientific but moral decisions. The individual that's going to be giving somebody a green light to proceed with something like this, he's being asked to play God now, as opposed to allowing science to make the determination. I don't know, Gary. There's just so many things here at play. I am so blessed that I don't have to make these decisions, let alone be in that position. But to make a decision like that on the future of a human life, not purely based on terminal medical conditions, that economical implications that may start playing a part in that decision. Wow, that's a little. I don't know, Gary. I mean, my opinion is that's just a little much to ask anybody to make decisions on, because there's no right and wrong in this particular case.
Right. Now, there are discussions about, the safeguards and expanding safeguards around this whole thing, because if you recall, a couple of years ago, there was a situation where a veteran was advised by a field worker, Department of Veterans, a field worker, to seek medical assistance in dying, because it would be better than waiting for it, because they have to wait a long time for a certain level of treatment. Again, when that broke, it was like, what the hell? Did I just hear this correctly? That now we're telling older people, and especially like veterans, that
go kill yourself.
Yeah.
Basically, it's like, what the hell?
There are no words, and so now we get into the whole level of trust as well, and public trust in medical and policy frameworks. I don't know if I trust the policy framework at the moment, how far it can go. And I have more trust in the medical side, but you start to question everything at this stage.
Yeah.
You really do.
The individual telling the veteran, as opposed to give the system more time to help you, let's move you towards MAID, MAID. I cannot believe that somebody in our government who's working as part of as a federal employee would actually make such a horrific suggestion to anybody that's at a hospital. I hope this individual was tarred and feathered, because that's just wrong. You can't just go tell somebody to go ahead and terminate their life. I mean, it's just not right, ethically, morally, and from a humanity perspective. That is just not right. Encouraging somebody to go kill himself because of the fact that happens to fall under some sort of law. You know, that's okay to do so. And you know what? And when you spoke about you spoke about checkpoints and how to make sure that this doesn't become a rampant. I'm not going to call it a free for all, but that we make it as difficult as possible for it to happen if the circumstances that are not there. You know, for somebody to arbitrarily say, well, you know, it's going to take so long to help you, you might as well use the government's MAID program to move forward on this. Is that just somebody not caring anymore and just wants to take the easy way out? Or I don't know what the circumstances were behind that. Regardless, you just don't say things like that.
Yeah. And Monel asks, oh my God, how horrible. How is this possible? Yeah. And that's a question we're asking tonight for sure. Like, how is this possible? Again, as I say, I'm at a loss for words. And it's, what it's doing, Eddie, is it's testing this country's ethical identity and whether true choice can exist. When financial hardships shape the options available. Like, it's, right. Wow. I'm at a loss. And we do have another comment here from Monel. And at least this person reached out to someone. I hope that MP was able to help with services we offer in Canada. There must be something. I definitely would hope that there is something for sure. But again, when you're looking now at the cost of groceries, and you can go 5 days this week to your local supermarket, and every day you're going to notice 2, 3, 4 things have gone up in price since the day before or a couple of days ago when you last looked at it. It's really getting out of control. And I know the government is spinning, and I get it. And some of the experts are saying, and it is true. Over the last couple of years, North America has experienced some really wacky weather systems. And a lot of damage between wildfires, heavy rains, hurricanes, tornadoes, sudden snap freezes, droughts. All of it has had an impact on our food chain. And then you have rising costs as far as transportation is concerned. We also, because we've put so many eggs in one basket as far as supply line is concerned, with the tariffs and the trade war, all of the produce coming in from the U.S. is a hell of a lot more expensive than what it was a year ago. A lot more expensive. So I get the cost pressures. However, on the other side of it, Eddie, like, think about this for a second. Not one grocery chain has, over the last quarters, posted any kind of a loss. They're all posting decent profits, and in some cases, record profits for the year. So something's out of whack. I get the increased prices, but ask the farmers at the gate. Are they getting, higher prices for their goods at the gate that they're selling to the wholesalers? I doubt it. If they are, it's minimal. And then, you have situations where I understand that the beef herd's being built back up in Western Canada, and if some people in Alberta have their way, we won't have access to it, and if we do, it'll be costing us even more than what it does now. But beef herds were culled for a while, and it takes a while to build the herds back up, and so there are a number of external factors on food prices. But a lot of seniors who are living by themselves now, and I'm sure, Eddie, like you've witnessed it yourself. There are a lot of seniors living by themselves, advanced in age. They still can get around. They're still mobile to a certain degree. But all they have is just their CPP, and they probably don't have a lot built up in it. The OAS, and then the other payment, which just escapes me now. But for some of these people who are like in their upper 80s and 90s, that wouldn't add up to a whole lot.
No, I mean it's far from a living pension, if you want to call it, when you can't pay the rent and the rents continuously keep on climbing, especially here in La Belle Province in Quebec. As you mentioned, the food costs just continue going up. Utilities keep on going up, Gary. I mean, Hydro-Quebec is constantly raising the price of power. There is not much left at the end of the day for the people who struggle, especially the elderly and worse, elderly and sick, trying to eke out a decent life month to month. I mean, never mind living paycheck to paycheck or pension check to pension check. This is basically an uphill battle where they're behind the eight ball for months and months and months. And then, decisions like, all right, great. In order for me not to get thrown out of my apartment, I have to not eat lunch for the next 5 days. That's just wrong. And you know what? Great. The generosity of food banks that are also struggling. How does somebody in their mid 80s to 90s get out of their apartment to actually make it to a food bank to help themselves? There's just so much, Gary, that the elderly and the individuals, that the people that cannot get around, that have who are incapacitated mobility, to be able to get to where they need to get to be able to feed themselves. And this is just one of the small problems that they have to overcome. And again, it just boggles my mind, Gary, that in our country that prides itself on its social net, that the cracks in the net, or there are holes in the net that are so wide that people are considering ending their lives because of the fact they fell through the hole. Don't you think it's our government's responsibility to quickly identify what those holes are and mend them and try to find some way that the people in the latter years of their lives can leave this earth with dignity, as opposed to having to make a horrid decision that, I got to go because I don't want to be a burden to anyone and I don't want to live on the street. I, for one, Gary, would back up or push for a plan like this because, you know what, Gary, both you and I are pretty fortunate right now. We're not there. And I think it's just a question a lot of us maybe looking at things through pink sunglasses, rosy sunglasses. It can very easily happen to any of us. When I'm in my 80s, hopefully I'm not alone. But if I am alone, well, things are going to get very tough very, very quickly. Having to fend for myself in my 80s, my knees, my back. Who knows? I might not be able to get out of the house. Maybe I'm living up on the third floor somewhere. Then what?
Well, exactly.
Yeah, I'll tell you what, Gary. This segment one here, when I read the outline, it really, really, really struck a nerve in me, and it made me look at things in our country, in my neighborhood, a whole lot differently than I did last week when I was back in town.
Elizabeth says, I'm shocked living in the USA and having all this crap going on here and realize all government is corrupted. Sad to see. And then she came back. Let Don't want to get ahead of myself. We'll get back to Joe in a second. There we go. Elizabeth came back with, is this crap happening because of the Trump regime? Well, it's in the U.S., yeah, for sure. Is it having an impact? Yes, it is having an impact on us as well, in combination with a whole lot of other factors, such as, the natural disasters that we've experienced over the last number of years. And whether you're a denier or whether you do believe in climate change, the fact of the matter is our weather patterns have changed and have created some real problems for farmers all around. Now, let's see if this will go. And now, here we go to Joe. This is an eye-opener. A 26-year-old mentally ill man was denied MAID in Ontario. It was granted the service in BC. He was not terminally ill. There needs to be more safeguards. Wow. Now, he was mentally ill. So, obviously, he had the capacity, though, to just keep pushing through, and he had a wish. And so he found BC, where he could get it done without the hassle that he went through in Ontario. 26 years old.
Yeah. Also, Gary, I was having a discussion with my wife about this today. Quite emotional, actually. And do you think, Joe's just giving us a perfect example. Do you think there potentially might be a large volume of individuals, quite a few individuals, that as opposed to them taking their life by other means, are finding, well, you know what, I can't kind of do this to myself, so let me see if someone else will do it for me? Are we going to be running in those types of scenarios more often than not? And it goes back to the previous comments about safeguards. Who is going to be administering these safeguards to ensure that people are just not using this as an easy way out to something that they've been pondering for a long time and couldn't do themselves? I don't know, Gary. The avenues of discussion, the rights and discussing rights from wrongs, it just kind of branches out with every discussion on this particular topic. And I've only been talking about this for a couple of days, and so many different circumstances come through my mind in terms of A, how wrong this is, and B, how right this can be if properly managed. And how do you find that medium between the two without finding that someone made a very tragic decision where it didn't have to get to a MAID situation. Wow, what a conundrum. It's really it's hard for me to fathom. I know you're struggling with this. I just don't know how the decision makers and the policy makers for managing these safeguards are going to be able to deal with this. I don't know, Gary. I'm not saying this is right. I'm not saying this is wrong, but it's something that you just can't ignore is not happening based on what you just showed us at the beginning of the segment from the MP in the House. Like it's out there. This is happening on a daily basis. Now, what do we do as a society to help? Now, I know in the United States it's every man for himself. But here in Canada, we pride ourselves on our social net, as I mentioned before. How do we strengthen it? You can't do anything without money. At the end of the day, it's going to cost money. Where are we going to get it from? It's either from your pocket and my pocket, or somebody else is going to have to pay for it. But it's
future generations with the deficits we're
future generations. Yes, yeah.
So, I'm going through some material that I have dug up while doing some research for this, and it's become highly controversial here in Canada due to the reported cases, which we're talking about now, where individuals requested death not solely because of the unbearable physical pain from a terminal illness, but due to the socioeconomic suffering, lack of access to medical care, and fears of being a burden on family and or society. Lack of access to medical care, another reason that someone's now requesting assistance in dying. That speaks volumes to a huge issue in this country when it comes to healthcare. As much as, again, and you've heard me say this, I don't know how many times in the last 71 episodes, but as much as we brag about having universal healthcare, it doesn't really cost us anything out of pocket. No. When you're doing your income tax, it does, and when every time you pay tax on something, it's, some of it's going there. But the fact of the matter is, the amount of money that this country is spending on health care and the level of health care we're getting, and I'm not dumping on the frontline workers, we don't have enough of them. And one of the reasons we don't have enough of them now is I think a lot of younger people are shying away from it. It's not the career that, used to have a real attraction for young people because of the ability to help people and save lives and, status and everything else. It's not there anymore. It's tarnished. And when the pandemic hit, it really became tarnished. It's not attractive to young people as a career any longer because, they're burning out. They're burning out, in no time. So with the amount of money we're spending, a huge chunk of it is going to the bureaucratic side of the little kingdoms that people have built up in regional health authorities and in areas where hospitals are being run by, as individual entities, all of this sort of thing. The amount of support staff and bureaucracy far outweighs the number of people on the front line trying to provide service. And every week now, from somewhere in this country, you read or see or hear a story about someone who waited for 10, 12, 15 hours in an emergency room in pain, had been triaged. They go home, and first thing, they collapse dead.
Yeah.
And some people, and during the pandemic, it happened in Fredericton, and I believe in a hospital emerge room in Moncton, New Brunswick as well, during the pandemic. Died in the emergency room, waiting to see someone.
Every province, every one of our provinces has a horrific story to tell, and you and I, being our nose glued to the news feeds, every week we see something happening in some province or territory in this country of ours where somebody has died waiting to be seen. Especially when you read about 10 to 13-hour waits. I read one this morning, 10 to 13-hour wait for someone who was complaining of chest pain, only to be sent home and then coming back into the hospital and sent into the acute cardio ward and dying there. And then the explanation to the family was, we missed that one. Whoa. I mean, Gary, we're seeing these stories every week. And again, it's through no fault of the frontline people. Both you and I have been lucky to get excellent services at the hospitals we've gone to when we needed them to take care of us, okay? But both you and I have seen the look of strain on everybody's faces there that were attending to us medically. And they still try to do it with a smile on their faces. I talked about a story not too long ago where, I walked into the hospital at noon one day, and then I was still there for, 12 hours after that fact, and the same emergency doctor saw me, and her shift wasn't finished yet. And I'm not talking about a resident. I'm talking about a seasoned professional as gray as me, putting in 14 to 16-hour days. it's just not sustainable, Gary. And you know what? You're mentioning the younger generation no longer are sharing that interest we all had about helping and being someone in society, being a doctor, helping people out. Nowadays, it's more about the work-life balance. Well, you know what? If I do this, what kind of impact is it going to have on my personal life? And do I really want to sacrifice all of that? And the unfortunate thing today is it's not very attractive going into the medical profession because of what's expected of you, both during your education and your formative years. And then once you're actually a bona fide medical doctor, especially in Quebec, to be completely insulted in terms of the way you're going to be paid, where you're going to be sent to practice and whatnot. So our governments don't make it easy in attracting medical students or people to go into the profession. And our governments don't make it easy for them to be able to apply their trade in taking care of us. And then they don't make it any easy for them to actually stay. So you know what, Gary? It's just I'm finding that I'm reading these horrific stories on a much more frequent basis, even compared to last year when we first started our show 1 through 25, for example. You only saw it once in a while. I see something now once every week or two about this. And you know what, Gary? It's not going to. Unfortunately, it's not going to get better.
No.
It's broken, and there just doesn't seem to be a will to fix it, to find the necessary funding. Taking it from dead zones, if you want to put it, of people that are there because of tradition and they've been there for kingdom come and don't do any work. Well, you know, it's time to trim the fat in some of these places, and we've both have seen the fat. You mentioned the fat over in New Brunswick a couple of times already, and having two distinct organizations depending on language. We've got that same issue here in Quebec. And I'm sure other provinces have other issues from an administrative perspective. You know, it's time to make those very, very, very tough decisions and put foot to butt, clamp down, understand exactly what this province and this country needs in terms of medical support for the entire country, and get it done. You know what? Professionals will find alternate forms of employment. There's just too much fat out there. I agree with you 100%. Sorry for getting emotional, but this whole segment one has really, really ruffled my feathers. I'll tell you that.
The other side of it is, Eddie, that we are competing with the world now for medical professionals because there's such a shortage. So many people have shied away from getting into the profession. Doesn't matter if you're in North America, Europe, you name it. We're competing on a global basis. And at one time, this country could attract a lot of top-level professionals without any trouble whatsoever. But our reputation, especially when they come in and they see how things are being run on the front lines, and just even our, the uproar with family doctors here in Quebec and how they were treated. And even though Legault managed to kind of smooth the waters a bit, they really didn't get a very good deal coming out of that at all. But, you look at that, and then the taxation burden in Canada, especially in a province like Quebec, we are really in a very competitive market. And for whatever reason, as a country, and maybe the federal government has to step in and say, look, let's pull everyone together. And we've got to look at this healthcare system, A, as far as how efficient or inefficient it is, and B, how can we make it more attractive to professionals to come here and set up.
That is very interesting what you just said, Gary. I mean, look, Prime Minister Carney, in all his wisdom in dealing with the Trump factor, pulled in all leaders of this wide and big country of ours. 10 provinces, 3 territories, in a room. This is how we're going to deal with the American threat. This is how we're going to deal with Trump. And I think we had the moniker of Team Canada, right? We had Premier Ford consistently call the entire group, Team Canada, we are going to overcome this together. And you know what, Gary? You are absolutely right. We had a national emergency with what was going on with the United States and the threats towards us. It's high time that someone, Mr. Carney, you need to call an emergency meeting with every leader in this country, get them into the room and call it Team Canada too, because this is a crisis that's just getting worse, not day by day, but Gary, exponentially, absolutely exponentially. And you know what? It can get to a point where it's so out of control that there is no way to fix it. They got to do something soon. Mr. Carney, if you're listening and watching the show, like Mr. Polyev, you got to do something about this. And Gary, you're absolutely right. They've got to get together and do something about this, because it's really becoming a national crisis, beyond national crisis.
Let's go back to the comments for a moment. Oh, and there we go. And Elizabeth, there. Wow, is that a legal thing that happens in Canada? I'm so out of it. Assisted dying, and then, yeah.
Sad emoji, yeah.
Yeah. And, yes, and it is. And speaking of that, just a couple of things to bring up in the research I did. Lack of support and housing reports indicate cases where individuals, including those with disabilities, have sought MAID because they could not secure affordable, accessible housing or adequate home care. And of course, not wanting to be burdens, a significant portion of MAID recipients, 35.7% in 2021, identified the perception of being a burden on family, friends, or caregivers as a reason for their request. 35.7%, Eddie.
Oh my. Wow.
35.7%. I couldn't believe that when I saw that. And systemic failures. Critics, including UN human rights experts, have noted that MAID is sometimes more accessible than necessary disability support. So, yeah, sometimes more accessible than necessary disability support, such as wheelchairs or in-home help, leading to fears that the program is being used as a substitute for social care.
Whoa.
And medical care access. Instances have occurred where people choose MAID while on long wait lists for treatment or after being denied proper care. Wait, did you hear what I just said? After being denied proper care?
Yeah, I was just trying to assimilate that in my head. After denied, how can you be denied proper care? Based on what on what grounds? Like,
you know, and a couple of other things. Poverty as a driver. The high cost of living in this country, particularly for those on disability support, has forced some individuals into severe poverty. One notable case involved a man who sought MAID because his rooming house was for sale and he could not find affordable alternative housing, stating homelessness is not an option.
Yeah.
Economic inequality. Research suggests that Track 2 MAID applicants, those whose deaths are not reasonably foreseeable, are more likely to come from poorer areas, be younger, and have no immediate family.
Wow.
A couple of other quick things, and then we'll wrap it up. Expansion versus safeguards. The expansion of MAID Bill C7 to include individuals who are not terminally ill has raised concerns about premature deaths. Mental health debate. While mental health illness as a sole underlying condition was set to be included in 2024, the expansion was delayed until 2027 due to concerns that the system is not prepared to safely handle such cases. Dead people don't cost money. Advocacy groups and legal experts have raised alarms about the economic as well as moral calculations involved in expanding MAID, noting the potential for it to be seen as a cheaper alternative to social support. It seems like a stretch that you would even make that kind of suggestion in Canada.
You ever see the movie Logan's Run?
No.
This is a utopian world in the future where the society rid themselves of any sort of individuals that can't take care of themselves. That by the age of 30, everybody goes through this ritual where they basically their life is terminated. That statement there that you made about it doesn't cost money is very typical of that utopian movie made 50 years ago, about people ending their lives at the age of 30. So anything over 30, nobody has to worry about. And to think that we're actually coming to those kind of decisions today, where we're just arbitrarily writing off anyone that's elderly and cannot afford to live any longer, and not because of any sort of physical or mental ailments, it just blows my mind, guys.
Yeah.
So I'm glad this entire segment has been a real eye opener for me personally here.
Well, a couple of other things. Inadequacies in the system. Evidence shows 70% of Canadians who want to die at home with palliative care cannot access it. Yet the same system is expanding access to medically assisted death. And proponents, though, say that MAID provides autonomy and dignity to those suffering from intolerable conditions, whether they are physical or mental. And some, including Dying with Dignity Canada, argue that the data does not show that marginalized people are disproportionately accessing MAID compared to the general population. The government maintains that 2 independent assessments are required to confirm eligibility, and that MAID is intended to be a last resort.
Mm-hmm. It seems to be getting a little further away from last resort here, from what we've talked about the last 45 minutes.
Yeah, exactly.
Doesn't sound like last resort to me.
Now, just before we wrap up, I do want to say this. If you or someone you know is in crisis or considering suicide, support is available. Here in Canada, you can call 988 or text 988 to reach the Suicide Crisis Helpline. Once again, that is 988. Call or text to reach the Suicide Crisis Helpline.